Would doing a first morning catch pH analysis be helpful at all during the detox, or is that just going to constantly be getting up and down because of the whole detox cycle?
Well, the first morning urine pH, as we know, looks specifically at net metabolic results overnight because you've rested. And so you've equilibrated the fluid with the cells, with the bladder and kidney cells. So you're actually getting a non-invasive assessment of metabolic cellular acidosis or healthy alkaline reserve. So that first morning urine pH is something we recommend using the high contrast 5.5 to 8 color strip every day of the year, or as many days of the year as you can. And if you miss a few days, it's okay. But one of the things that most of us do is we get up in the morning and we have certain habits. Hopefully that has to do with good oral hygiene. And it turns out that just brushing your teeth is a really good thing, and brushing it with potent Seaguard powder is a better thing. And potent Seaguard powder maybe plus some other minor dentifrices. For example, lemon oil or lime juice will whiten or lighten your teeth. For those of us who drink coffee, etc., this is a little pearl, will lighten your teeth, as well as these expensive whitening strips. And probably better for the surface of your teeth, because if you use the PERC Potent Seaguard, you'll remineralize the dentin. The dentin is the protective outside layer that allows our teeth to live as long as we do. So it's a good thing to top up the calcium and minerals in the dentin, which you get from the PERC Potent Seaguard. The effervescence helps. The antioxidant helps reduce some of those colored compounds. And when you add to that some lemon or lime juice to activate the effervescence, if you will, you have nature's mouthwash, nature's detoxifier in the mouth. But what about the rest? Well, the detox in the box, the 1 month a quarter, covers the spleen, liver, kidneys, and the rest of us. Then we want to add the self-assessments. First morning urine pH, transit time, how long from consumption to elimination, hydration status. We want to make sure that we have lots of water as our beverage of choice. And there are people who say, look, I want to be hydrated, I just don't want to drink water. Okay, eat more vegetables, juice your salads. There are lots of ways of having herbal beverages or water with lemon and lime, water with the potent Seaguard to make it more interesting. Lots of ways of getting the water in. However you do it, you need to assess yourself on a daily basis, whether you're doing the detox that week, that month, or whether it's just survival habits. And by the way, when we're more stressed, when we have more immune interactions, or when we consume foods or chemicals that induce delayed allergies, there'll be a burst of acid that has to get cleared out of the body. So yes, the pH will go up and down, but when you do it after 6 hours of rest, you have a meaningful measure of what's going on in the cells. When you combine that with transit time, you have some sense of whether you have enough prebiotics, probiotics, and symbiotics. And if the transit time is more than 18 hours, you enhance the fiber, you enhance the fermented foods and the Digesti-Guard, Regularity Guard combo. And you add to that the recycled glutamine so that you energize and repair the gut without glutamate building up. So we believe in a best of both approach. We want to do things that are synergistic. We want to do things on a daily basis, like measure pH, etc. We want to do some things on a weekly basis, like the Sea Cleanse. We want to do some things more like on a monthly basis, like check your transit time, periodically when you want to check your hydration status. These self-assessment things that cost maybe $1 or so or less a day, or a test, we think are really important to improve understanding, to help people understand that it is all about them, because it is all about them. Who else would it be about except them? So we want to put this back, put this information, this inspiration, this knowledge, this motivation back in the hands of people so that they can survive well in the 21st century and know how often to do what in the optimum case, but also in the adequate case. And heaven forfend, if you haven't been doing this for a while, By gosh and golly, get on it.